There is new progress in the fight against the coronavirus as the world marks 2 years since the first human case of COVID-19 was reported in Wuhan, China. The FDA and CDC could expand booster shot use this week. Pfizer is also asking for emergency use authorization for its antiviral pill to treat COVID-19. The Biden administration is already planning to buy 10 million doses of the pill. The drug makers also made a deal with a UN-backed group earlier this week to make it easier and cheaper for other countries to get access to the drug. CBS News' Naomi Ruchim has the latest.
Almost 200 million Americans are fully vaccinated against COVID-19, but breakthrough cases are surging across the country.
Although the highest risk are those people who are unvaccinated, we are seeing an increase in emergency department visits among adults age 65 and older, which are now again higher than they are for younger age groups.
With the latest spike creating a new urgency, the FDA is expected to authorize the Pfizer vaccine booster for all adults as soon as tomorrow.
Soon it's going to go down at all ages, and you're going to see a waning of immunity that impacts not only cases, but ultimately hospitalization.
The CDC currently recommends boosters for people 65 and older or at high risk. But at least 7 states aren't waiting around for the federal government to revise that policy.
Anyone who wants a booster can get a booster shot. If you have been vaccinated and it's been 6 months, now you can get a booster shot 18 and over.
And as the holidays approach, many Americans may heed warnings about indoor masking. A recent survey found about half of Americans will ask their holiday guests to wear masks, and nearly 3/4 say they plan to celebrate with members of their household. Polls also show the majority of people hosting Thanksgiving dinners will not ask their guests about their vaccination status. Naomi Ruchim, CBS News, New York.
And Dr. William Schaffner joins me now. He is a professor of preventative medicine and infectious disease at Vanderbilt University Medical Center. Dr. Schaffner, great to see you again. Of course, as we've been saying, the FDA could approve the Pfizer booster shot for all adults by the end of this week. I actually have my appointment made in anticipation of this approval. So how much of an impact do you think that will have? COVID cases are starting to rise again, and with the holidays coming up, we could see another spike. So do you think approving booster shots for everyone over 18 and older will have an impact?
Well, Tanya, it very well could, because it makes good sense that we provide these boosters to everybody, which will indeed enhance their protection. And as we move into the holiday season, anything we can do to enhance protection is good for those already vaccinated, and even more importantly, for the folks, about 60 million adults, still 60 million, who still have not availed themselves of this vaccine. Now is the time for them to get vaccinated.
Let me ask you a question for all those adults out there, though, who are getting ready to get that booster shot, like myself. We've heard about these breakthrough cases where some people can get affected and have absolutely no symptoms. I mean, you can have no symptoms even if it's not a breakthrough case. But how might it affect you if you go in to get your booster shot and maybe you have COVID-19 and you don't even realize it?
Actually, it will have no effect adversely on you at all. Your body will get vaccinated. You'll be enhanced in your protection going forward and protected against even future infections.
That's very good to know. Now, Doctor, we know that we can see this authorization for the Pfizer booster shot for all adults very soon. But what about Moderna? Any guidance on a timeline for that booster shot? And additionally, when do you think we might be able to see, or it might be prudent to give booster shots to teens?
Well, we're not up to the teens yet. We'll have a look at that very separately. But the Moderna folks are in line. They're gathering their data, making their submissions to the Food and Drug Administration. And actually, in the near term, if you were vaccinated with Moderna and are now wondering about a booster, it's okay to mix and match. You could get a Pfizer booster if you chose.
That's good news as well. So, let's talk a little bit about this Pfizer COVID-19 pill. Realistically, how far away are we from seeing the authorization of this pill? And then once it's authorized, how far away are we from the time when it will be easily accessible?
Well, all those questions are yet to be determined, Tanya. For sure, I would think it may take a little bit of time for the Food and Drug Administration to carefully review those data. Let's say a month, 6 weeks, something like that. That's a reasonable expectation. And then the question will be, how will this medication be distributed? Because I think it will be targeted at people who are recently infected with a positive test, who are in high-risk groups. Where will they then go to get the medication? To their health department, to a pharmacy? Will it be available in doctors' offices? Or will we send it to them by FedEx or UPS? That's all to be determined.
And can you give us a little more clarity as to who exactly this drug is meant for? Is it just sort of an all-around, anyone with COVID symptoms should take this? Or is it geared towards, serious symptoms? Any specific group?
So far, the medications by both Merck and Pfizer have been directed at people who are more likely to get serious disease. People age 65 and older, anyone younger than that who has serious underlying illnesses, and of course, anyone who is immune compromised. So we're aiming this at the folks who are more likely to get seriously ill, at least at this stage.
And do you think that this pill, is a sort of a game changer? I mean, my concern is it sounds great, but it might be hard to get your hands on at the time you need to take it, because you need to take it rather quickly, correct?
You need to get tested very quickly. You need to get your test result back, and then you need to get your hands on the medication. It's no substitute for vaccination, that's for sure.
Right, because a lot of things have to fall in line. And speaking of getting tested quickly, where do we stand with, sort of more accessible rapid tests? I mean, I still feel like we're at the point where every American family should have a stack of rapid tests in their home, easily accessible and easy to use, and we're still not there yet.
Tanya, you and I are together on that, and I just had a big sigh because I wish testing were much more widely available. My son lives in Europe. It's much more widely available there, used in many, many different circumstances. We really need to move in that direction because testing is not a complete answer, but it sure would help many of us reduce our risk and give us reassurance that we're not infected.
Absolutely, especially with so many, as we said, asymptomatic cases. It would just give us a peace of mind. Well, Dr. William Schaffner, thank you so much for joining us. We appreciate it.
Thank you.